If your breasts are suddenly feeling hot, swollen, heavy, so full that the skin has become tight, the areola are stretched, they're tender to the touch, and your baby is unable to latch, you might be thinking something has gone horribly wrong, and you may even be questioning whether or not you can continue breastfeeding. Engorgement usually starts around day 3 after your baby is born, when milk production increases and your milk is transitioning from colostrum. It's also caused by an increased blood flow and lymphatic fluid in the breasts, which adds to that feeling of swelling and pressure. It doesn't necessarily mean something is wrong. It means your body is adjusting to early milk production, and it is very much part of the process of you establishing your milk supply. And with frequent feeding and good management, it will usually begin to settle within a few days. So the goal isn't to avoid it entirely, but rather to manage it well and keep the milk flowing. The most effective relief is frequent feeding. So you want to aim to feed responsively and regularly, including through the night. Now, it is just unfortunate that when it happens, which is usually around day 3, it coincides with you crashing with hormonal changes that are associated with this change that make you feel overly emotional, with sleep deprivation, and also with your baby waking up and wanting to feed more frequently. And in many ways, this waking up and your baby wanting to feed more frequently is what is going to help you get through it, especially if you are able to respond to that need that your baby is showing you, because they will help to keep that milk flowing. They naturally want to feed more during this stage, even though you are feeling so overwhelmed, and it is an incredibly difficult and emotionally tense and tender time. But by allowing your baby to feed frequently, the milk removal helps to reduce that pressure and shows your body how much milk is actually needed. Now, if your baby is struggling to latch, which very often happens when they are so full because the areola is so tight, you want to try softening the area behind the nipple by gently pressing back around the nipple just to move the fluid away enough to enable your baby to latch comfortably. Rather than using a pump, hand express just enough to soften the areola, and you can use warmth or warm water before the feed, but keep it brief and gentle because prolonged heat can increase the swelling, which obviously we want to avoid. You may consider using a silicone nipple shield to help latching easier, but I highly recommend only doing this with the help and assistance and guidance of a lactation consultant who will be able to help you use it responsively and wean you off it once the engorgement has settled. After your baby has latched and fed well, a cool compress will usually help to ease and soothe that feeling of fullness, and specifically a cold cabbage leaf, which sounds crazy, but there's healing properties in that cabbage that you keep inside the bra for 15 to 20 minutes, which really does help to relieve that feeling of fullness, and usually is only required for the 2 to 3 days that engorgement is at its worst. You may wonder whether it is not just easier to pump to relieve the fullness. But the goal isn't to empty the breast. So frequent pumping to empty the breast can actually have the opposite effect, stimulating more milk production and sometimes prolonging that engorgement and worsening the cycle of fullness. More pumping doesn't always mean more progress, so frequent feeding is the best way to keep the milk flowing rather than thinking the goal is to empty the breast. What will help while you're feeding are breast compressions. Breast compressions can help milk flow and encourage active feeding. Place your hand in a C shape around the breast, well back from the nipple, and gently squeeze and hold while your baby is actively sucking. Then release when they pause. You can move your hand around to different areas and repeat, and this should feel like firm support, not pain. So if at any time this is causing more pain, rather don't do it. Other things that will help is wearing a soft, non-restrictive bra, making sure that you're drinking to your thirst. So there's no right amount of fluids that you should be drinking, but if you're very thirsty, it means that your body is wanting and needing more fluid. I like to say rest where possible, but I know that resting when you have a newborn baby is incredibly difficult. But bear it in mind because it's important that you do get enough rest wherever possible and whenever possible. Keep feeding cues as your priority. It is your baby's feeding cues that will allow you to feed responsively. And the feeding cues that you are looking for is your baby rooting, turning towards you, lip smacking, opening their mouth, tongue sticking out, and making small noises when they wake. That signal that it's time for them to feed. Remember, as mentioned earlier, the feeding cues will be frequent in this period. It's going to help you to keep the milk flowing. Your baby will probably not let you have long gaps between feeds in these early days, and that's exactly what you want. Introducing bottles or supplementary feed is not recommended and can sometimes reduce feeding opportunities and mean that your baby doesn't feed as frequently as they might, which is not going to help you. If you need support because your baby cannot latch, because the engorgement is getting worse rather than improving, if you notice any red patches on your breast or fever, flu-like symptoms, and the pain feels severe or persistent, get help early and often from a trained professional lactation consultant who can guide and assist you to manage the engorgement so that it does pass within 2 to 3 days, and in doing so is the beginning of establishing the right healthy milk supply for your baby. Remember that if your breasts are feeling painful right now, you're not failing, your body isn't doing something wrong. It's a short-lived stage of adjustment. Feed often, make sure that you're comfortable, get help if you need it. And if this episode has helped you, you can download the free handout that goes with today's topic using the link in the show notes. I've designed it to give you something clear, practical, and easy to come back to when you need it. And you'll also find some quick 2-minute answers there that you can listen to. And very often moms love to binge on these questions and answers because if you're nap trapped and you're unable to read something, it's just a matter of pressing play. And I've answered the most frequently asked questions that happen in the first 6 weeks. If you haven't already got my book, Baby Steps to 6 Weeks, and you're currently pregnant, I highly recommend that you get it. Read through the first section that is going to guide you as to what to prepare and what to expect when your baby is born. But when your baby is actually born is when you are going to use the book, and keep it open and take it with you wherever you go. It's a day-by-day guide for the first 42 days, helping you understand what's changing, what's normal, and where to place your attention each day.